Hi, my name is Marisa Salisbury, and I'm going to be talking with you about the hazard analysis I completed for the machine shop at the Biddeford campus of the University of New England. It's really important that we understand the potential for occupational injuries and the ways we can reduce the likelihood of our staff becoming injured. Injuries don't just involve physical, but it could be mental. It doesn't necessarily mean something that we know that they're sick or injured right now, and it could pop up years from now. So we want to reduce those likelihoods to the best of our ability to keep our staff healthy and productive. But before I go into about the campus, I want to talk for a second about Maine. Maine, when we looked at 2016 numbers, and specifically maintenance and repair workers, the injury reports made up 2.3% of all injury reports in that state. Now, what that translated into is over $850,000 in medical costs and over $1.3 million in associated costs. So we're only speaking of those 2.3%, okay? Only maintenance and repair workers. Now, the surprising thing and the alarming part is the fact that it could be up to 69% of injury reports actually are not submitted. So it's underreported. That is a serious concern. Okay, so let's talk about for a minute about the machine shop. So when we talk about the staff, there's about 15 full-time staff, ages 30 to 65, high school education, some college. The average workday is 6 a.m. to 3 p.m. This is rather significant. We found out later because the exhaust fan is on a timer within the garage, and it's on that timer from 6 a.m. to 4 p.m. And we'll talk for a minute later of why that's significant. The tasks involve basically auto technicians, so it could be placing on hoists, changing fluids, tires, and so on and so forth. Now, what I looked at to decide, well, what should we do to focus on with the Biddeford campus? It was looking at observations from a video, interview with JCQ. We looked at hazard zone checklists, and in that hazard zone checklist, we also looked at things like air quality, potential chemicals that would be in the machine shop, or potential for physical, some physical encounters or injuries that could take place, as well as personal protective equipment or PPE, what's available, and do staff know that that equipment is available. We also looked at psychosocial and physical strain, so mental strain as well as physical strain. And I do want to say that what isn't in there is the Emergency Action Plan, or EAP. Now, that is required for over 10 staff, so I feel pretty confident there must be one there. I just didn't have access to it. Or the OSHA plan, and we didn't have access to the results from the hydraulic lift inspection. Those are required every 6 months in the state of Maine. So a hazard is basically anything that can cause adverse health. That basically summarizes. Like I said, it could be physical, it could be mental, it could be something you see now, it could be something you see later. And I identified 5 total of areas of concern. They were involved 2 environmental, 2 physical, and 1 potential pollutant. So awkward posturing, lighting, chemical, lifting, and then ambient temperature were areas I identified that were of concern, but I narrowed it down to 3 that I was looking at mitigation. So I looked at awkward posturing, lighting, and chemical. So when we looked at the lighting in the shop, it read at one point 122 lux, which is way below what studies recommend, which is up to 1,000. And that can lead to eye strain. It can lead to issues like of not being able to read a chemical properly, or misjudging the distance to a part. We also identified awkward posturing as a concern. And considering that musculoskeletal disorders make up 32% of all work-related injuries, this is important. Now, obviously, the hydraulic lift helps, but we should look at, ways that the employee, is there a lifting technique that they can do? Maybe it's also looking at whether or not the hydraulic lift is being used properly at the times it should be used, and so on and so forth. And then we also found out during the interview that there are numerous chemicals that are in use. Now, chemical accidental poisoning occurs in 35 million cases a year. So this is a big deal. So our staff understanding the potential for that, and do they know how to mitigate it? So when it comes to lighting, this can be a relatively simple thing to look at. Now, it may not be available structurally. The first step would be, okay, can we alter light structurally? Can we add lights? Can we add light bulbs? Maybe the strength of the light bulb needs to be increased. If that's not feasible because of the building itself, then we should look at other means like headlamps and portable lights that could be used that would increase the light, so that staff would be able to see better, less likely to injure themselves, more likely to be able to accurately read chemical bottles, more accurately able to see what they need to see under the hood, and so on. Now, awkward posturing, really to be thorough about this and get a really good idea of what areas need to be fixed. Is it an issue of having things like lift belts? Is it an issue of how to properly lift? Then there should be a 7 strategic measure step here. And so looking at those, it's everything from increasing awareness to including opportunities for employee learning. So it really should be all encompassing, from in-services to, it could be information and pamphlets that are available on site. The point is looking at every avenue where it meets the employee where they're at, and trying to accommodate and make sure that information is made available to them. Chemicals are a concern, especially if we're unaware of how much the employee is comprehending or retaining about how to handle that chemical. So when we see all these symbols, would an employee be able to look at these and understand what they mean, for instance? So this would really require looking at employee comprehension. This would require an employer that's willing to do things like surveys or focus groups, so they actually are hearing from the staff member a level of understanding of where PPE is, what should be worn when, and any kind of health hazards. Maybe, for instance, there are some women that work in a machine shop. Maybe the concern would be that those of childbearing age are not handling certain types of chemicals. So those types of things should actually be looking for some type of feedback from the staff member to make sure they understand the dangers of what they're using. Thank you very much for your time, and I hope you have a wonderful day.